many are infected. Right here in our own state of Minnesota, we are very limited in testing, and many people who should be tested with compatible illness are not getting tested. So again, these numbers, while they surely do show that there is a lot of transmission going on in our communities, they don't really give us an idea of what's going up or down. In terms of where this will end up, first of all, you have to understand this is going to be a series of rolling outbreaks. This is not just going to be one big peak and done. We expect to see New York and places like Seattle, where the virus obviously has been circulated longer than it has in other areas, may peak first, but eventually all 50 states will contribute to that peak. And I don't think that we can say when that'll happen. Clearly could be months away, and it could be literally many hundreds of thousands of cases.
What do you think in terms of that assessment there, that report from Imperial College, Neil Ferguson? We were just playing his projection there that if not enough is done, he's saying the fatalities here in this country could be 2 million. I've seen some people saying that you're looking at an assessment there that might be too alarmist, that might be too dire, others disagreeing. What do you think of the projections he's putting forward?
Well, actually, Neil and his group at Imperial College are one of the best in the world. I think it is very, very much a legitimate estimate that we have to deal with. And if I could just comment very briefly on this issue of too scary or the fact that we will panic people. You know, what people want right now is just straight talk. They want to know what we know and what we don't know and how we know it. I mean, I've not seen anybody in the streets rioting or cars turned over and burned or people even accosted in grocery stores when somebody got the last roll of toilet paper and I didn't. They're scared, they're fearful, but they're not willing to panic. They just want the right information. And I think this report gives us that information.
Yasmeen, there is the question that if more testing is resulting in this increase we're seeing here in cases, we've been talking so much about not enough tests being available, the volume of testing being low. What is the status of availability of testing right now versus where it was, say, a week ago?
So the number of tests has definitely ramped up, and you've seen that the administration is now trying to engage other parts of the private sector to set up these drive-through testing sites. The announcement was a bit premature. You know, the site is not ready to go. But, you know, I think the goal is to have that set up by the end of the week and to have some more sites roll out over the next couple of weeks. So we'll see if they're able to get that off the ground and to sort of mobilize that quickly. But I think, as you said, you know, as the number of tests continue to expand, not just with this drive-through testing initiative, but with the engagement of the hospital and academic labs and private industry. You know, you've seen the FDA approve more tests from outside companies, that we'll continue to see a sort of increase in cases as more people are able to get more readily tested.
Meanwhile, communities across the country are hunkering down to limit their potential exposure to the virus, while the administration has recommended that Americans practice social distancing for 15 days. The Surgeon General today warned it could take longer.
Give it to us straight. Isn't this going to be longer than 15 days? How long do you think people should expect to be at home, essentially?
You feel like if we can get America to all pitch in for the next 15 days, we can flatten the curve, which is a term that you've been hearing a lot, not overwhelm our healthcare systems.
So
and
15 days is
this.
enough?
15 days is likely not going to be enough to get us all the way through, but we really need to lean into it now so that we can bend the curve in the next 15 days. And at that point, we'll reassess.
Okay.
And in the New York Times, Dr. Ezekiel Emanuel writes that Americans, quote, should plan for social distancing at least until mid or late May and be thankful if it eases off earlier. Congressman, you represent a district where this challenge is particularly acute when it comes to social distancing, a very urban district, dense population, a lot of folks living in small apartments there, where the challenge of just staying put and not moving and not going out can be particularly difficult. Realistically speaking, how long can this type of social distancing endure, especially in a place, an area like yours?
Well, I think people are doing their very best to keep their distance. Today, I was out in the community. We're trying to get also some testing, drive-through testing sites open. Hopefully, we'll get one open tomorrow, the day after. I just had a conference call with all the head presidents of the major hospitals in the 13th Congressional District. And business leaders and community-based physicians. I think they're all pushing hard to make sure that every family, every individual understands that there's got to be distancing between people, that people got to wash their hands with soap and water, that the best practices that are out there already should be adhered to. I think people are looking at that, and they finally start, I think, getting a grip of that and adhering to those practices. So testing is a big thing, of course. Your hygiene is a very important thing. Wash your hands, keep the distance. And then the next thing that I found out just now in this call that we had with the hospitals is that the protective gear that emergency and medical services people wear, masks and gloves and these types of equipment are not available the way they should be. They're running really low, and it's really putting healthcare workers in peril, in danger. So we must invest more in this type of emergency gear, equipment for healthcare workers, and the ventilators. We must have capacity when the pandemic surges. We must have the capacity to treat people. We cannot become, as we've seen in other countries, a country that determines who lives and who dies. We got to be there to protect them.
Yeah, Congressman, on that front, the question there of ventilators, of hospital equipment, what you're talking about, the need for that. We had that news at the top here, the president today invoking those emergency powers that would force contractors to produce ventilators, to produce medical equipment. Do you think that will make a meaningful difference in the challenge you're describing?
That will make a significant difference. If there's one thing that I heard from all the presidents of the major hospitals like New York Presbyterian, Mount Sinai, Montefiore, Harlem Hospital, is that they need that equipment immediately. They're running out of masks, they're running out of gloves. Again, the ventilators are critical as the disease continues to move at a high rate. Today, I was surveying parking lots to see where we can have a good drive-through testing site, because the money seems not to be getting here, or the help be getting here quickly enough. So I had to go out there with some local physicians to determine where we're going to partner with the hospitals to open up these drive-through testing sites.
Michael Ostrom, you said a minute ago, folks out there are just looking for simple, straight answers, direct, straight answers. I think that's absolutely right. I definitely put myself in that category. So let me ask you for one. How long, realistically, is this style of social distancing that folks are now integrating into their lives going to last? Because we have this talk from the administration there. You saw the interview saying, 15 days, but maybe a little longer. You have Ezekiel Emanuel saying mid-May would be a realistic goal. Be thankful if it ends sooner. We have this report we mentioned from Imperial College that's basically saying, hey, until there's a vaccine 18 months from now, this might largely be the new norm.
Yeah, so first of all, again, just from a straight talk standpoint, let's just clear up a couple things. One, I think the Imperial College report is right. It is going to be at least 15 to 18 months, and we're going to have to decide how we're going to live during that time, not just die from this virus. Second of all, let me just say what the president did today with signing that act is largely cosmetic. And I really resent the fact that we're trying to sell to America we're doing something we're not. Every company right now that makes in respirators, makes ventilators, makes protective equipment, have been working full time with every machine running 24/7 for weeks. There's nothing new coming. You just don't invent these overnight. And so we are going to be very short on these issues. And as far as testing, I think we're going to see an implosion in testing in about 3 to 4 weeks. We're running out of reagents. The world doesn't have enough reagents right now. So we do not support drive-by testing right now. We need to focus it in hospitals where it'll have its most important good. And we're going to be rationing testing in a way that we haven't even thought about just within a few couple of weeks. Because we can't.
I just want to go back to that first question I asked you, and I want to make sure I heard you right there. Is it your view, looking at this situation, that this level of social distancing will be the norm for 15 to 18 months?
I didn't say it'll be the norm. What I said is, if you look at the model from the Imperial College, if you want to suppress this, you want to not have cases occur where we flood the hospitals, and we have to do that. If we decide that's not what we're going to do, we're going to basically just try to protect those who are at greatest risk of serious illness or death, then we will see cases